You get to take care of people that are like extremely grateful.
As part of Operation Walk, a volunteer medical humanitarian organization, some local orthopedic surgeons and nurses traveled to Panama last month.
Helps not only spread good medical care to the rest of the world, but also brings a lot of skills and experiences to American healthcare workers as well.
A local team from the Orthopedic and Sports Medicine Center here in St. Joseph spent a week in Panama performing life-altering joint surgeries.
Everyone was just so grateful and happy that we were there. Everyone was smiling.
A lady had an accident 31 years ago.
Yeah.
And for over a year she's in the hospital because she couldn't walk, because she couldn't afford to have the surgery.
The team worked with other teams in Operation Walk to educate orthopedic surgeons, nurses, and other healthcare professionals on the advanced treatments and the latest in surgical techniques for hip and knee joint issues.
Perhaps make more out of what you may not have. You don't have all the fancy newest gadgets that we have here, but we can use these basic building blocks of skills that we can pass on.
You never know what to expect when traveling to a new place, but this team embraced the opportunity to help others, to give them a chance at life without pain.
For them it was more of a necessity because they couldn't physically carry on their lives or work.
Implants in the United States that would normally cost us $2,000 or $3,000 for a knee replacement or a hip replacement part is costing $20,000 or $30,000 there because they're paying the full list price.
Panama, Cuba, Guatemala, Operation Walk travels to countries all over the world. It's all about giving people, complete strangers, a better, healthier chance at life.
Another example of a patient is one who had terrible hip injury that had happened from falling off of a ladder, and he actually needed both of his hips replaced. His hips were so stiff that he couldn't bend them enough to sit in a chair. And we would ask him, hey, what are you most excited about? What do you want to do after you get your hips replaced? What are you most looking forward to? And every time we'd ask him, I just want to work and take care of my family. So it felt good to know that you were not only having impact on the patients, but also their entire families and communities that they were going to be returning to as well.
Chris Roush, KQ2 News.